Good morning, everyone. We're about to get started. Thank you all for coming.
All right, good morning, everyone. Welcome. I'm so glad that all of you are here today for this important webinar. Welcome to all the faith leaders. I see a lot of you in the participants list, so thank you for being here. We really need each other, and I'm so grateful to the county for partnering together on this, and I want to tell you that they put so much work into this presentation to really help us be informed so that we can inform our congregations and our communities. And so thank you for being here. Again, we need each other in this time, especially when the infections are surging and the hospitals are strained. And we're trying as faith leaders to provide comfort and compassion and healing and information. And so I'm just so grateful today that everybody on this call cares about the well-being of our county. And so in that spirit, I'd like to welcome everybody. I'm so glad you're here. And I know this will be a very beneficial hour together. Thanks so much, Maria, and thank you.
Thank you, Reverend Nixon. Welcome to everyone who is here joining us. Our webinar today will be recorded. As you will see in the next slide, this notice is stating that by your entry into the event, you are consenting to being filmed, and this recording will be shared later after the event. Next slide. I'd also like to review some of our Zoom housekeeping information. As you can see here, screen share has been disabled and participants are muted. To unmute yourself during the discussion period of the webinar, please use the raise hand button or the thumbs up on your phone. In order to give everyone a chance to speak, we are requesting a maximum of 2 minutes on comment time. And for questions, we ask that you use the Q&A feature, which is at the bottom of the Zoom screen. We will do our best to answer all questions. However, we may not be able to get to all of them or have all the answers at this time. If you'd like, you may also give us feedback via email or phone after the webinar. And all presentation slides, and again, the recording will be sent out after the meeting. Next slide. So for today's agenda, it's pretty full, and we're going to be starting off with Dr. Curtis Chan, who is our Deputy Health Officer for San Mateo County's Public Health, informing us about the incidence, distribution, and other health factors related to COVID-19. This will be followed by our Office of Community Affairs sharing their resources and bridging our supports within San Mateo County. The second half of the webinar will allow for a feedback session and a closing by our Behavioral Health and Recovery Services Spirituality Initiative. Our intention for today's meeting is to hear your experiences via today's discussion and the SurveyMonkey questionnaire feedback form, leading us to be able to work to build and strengthen our relationships, create a second Q&A document for faith leaders, and introduce the Spirituality Initiative as a place for gathering together, information sharing, and providing mutual support. So I'd like to introduce Dr. Curtis Chan at this time. Thank you.
Good morning, everybody, faith leaders. I'm so honored to spend this hour with you, and I look forward to future discussion with you in these upcoming difficult months. My name is Curtis Chan. My family and I live in Pacifica, and my extended family lives in San Mateo County too. So my extended family has appreciated all the services you've provided for residents throughout the Bay Area. So most of what I'm going to say after this slides is really going to be my personal opinion as a physician for over 20 years. But the official documents and references about what's allowed and what's restricted are on these links. And I'll just comment on all of them. So one excellent one, if you go back to the health officer updates on June 15th, in which Reverend Nixon was co-hosting as well too. It's remarkable 3 or 4 months into the pandemic, what our county health officer was relating to you at that time. He really did have a lot of foresight on how the pandemic was going to evolve. And you could see that he was near, over 95% predicted where we would be now on December 3rd. So, and I think nearly every principle he conveyed at that time in early June on the June 3rd town hall is still very relevant today. And it also demonstrates how the wisdom that he has and that all of us have together is what's going to help us through this next, few difficult months together. And also all the questions that the clergy and other faith leaders had at that time were really on point and really relevant to the industry guidance that came out after that time in July. And I think the health officers across the Bay Area find that industry guidance, even a lot of the details, are really appropriate. There's a few adjustments that I'm going to comment on that we can bridge some of the new science to help us. So we're all in purple right now, but when more faith services are able to open up in red, orange, and yellow, how do we actually provide faith services so we provide healing, while at the same time we want to limit the amount of transmission into our community and to your congregation. The blueprint for the safer economy is what describes us in purple, and that's the reference for that and what's able to be open or closed. Dr. Morrow and San Mateo County Health want to support the faith community as much as possible. We don't envision that we're going to have anything more restrictive than what the state health department is requiring. And finally, I'm so grateful for the spirituality initiative within San Mateo County Health that has been convening leaders and thinking about how spirituality affects overall public health and mental health. So the next slide. So those are all the official comments. The next, oh, sorry. So as you all know, we've entered into the purple tier and will be in the purple tier for at least another few weeks until the surge is still rapidly going upwards. It's very scary. We're beyond the hospital, our hospitalization numbers are beyond anything that they've been before, and the case rates are going up. It's not only in essential workers, but it's in our entire community now. So we hope for a time when we'll be able to turn things around and the faith community will be able to shift back into the red tier, in which we would not only have the limited outdoor services, but be able to open indoor in a safe way. And that's what I hope that we will be able to have conversations about in the upcoming months. How do we safely open in red and orange and yellow? Because by that time, the amount of suffering that people will have through the holidays is going to be really just really terrible. So we're going to need to be working together. The next slide. So as I conveyed earlier, national data on mental health, mostly by survey and administrative data, really lags behind reality. What we've been hearing from our healthcare providers and even from the CDC survey that was done at the end of June really suggests that there's rampant depression, anxiety, fear, concern, social isolation, which leads to things like suicide, substance addiction, family violence. And, in my, like I mentioned, 20 years of practice in medicine and my decades of being here on earth, as well as your leadership of your faith communities, we've probably haven't seen this type of devastation for a generation or multiple generations. So we're in purple tier right now. So I think, those of us who are in healthcare, we can only see individuals on an individual basis, but all of you have influence and power to heal entire communities. So, I think that's the reason why we're here, just to really help figure out what are the rules of the virus, not the rules of the government, but really the rules of this virus that we need to learn so that we can heal our communities better. So I think I mentioned the first three already. Number 4, I'm going to describe the virus and just say that, since June, we've really gotten a lot more confirmation of how this is different than other viruses, such as influenza. The first thing is that at least half of the transmission of cases is due to asymptomatic transmission or pre-symptomatic transmission, so people who don't have the virus. So that makes, asking people if they have a cough or temperature checks, you're coughing into your arm. Those things are all very helpful, but they only really help at best 50% of the time. So it's still very, very helpful, but you're still missing 50% of the people who might be coming to your services and having transmission of the virus in 1 or 2 steps to people who are over 50, 60, 70 years old. So that is the major problem that we have with this virus. The second issue is that we've gotten much more confirmation, even from the CDC now, that the airborne small droplets, the best way, the most significant way it gets transmitted is through singing and chanting, and it gets airborne, and it can drift in outdoor environments, but not as much as it drifts within indoor environments and stays aerosolized in the air. So, I think that really impacts the faith community and some of the most important parts of being together. and also just even some interactions of things like eating after a gathering, after a church gathering. So this is the reason why we want to work together. For healthcare, since June, we've really increased testing. That should be community testing. Healthcare testing has been drastically improved many folds. That it's available. So we want to communicate that to your congregations and your communities if they come in to services, or if they're just informing them out in the community. And we really understand much more the importance of isolation and quarantine immediately after you've had symptoms, to start isolating and putting a mask so you don't transmit to other household members and other people of your social support bubble. And fortunately, the vaccine efficacy is beyond anybody's physician's most fantastic dreams. This seems to be very effective, but the process and fear about taking the vaccine is going to require a lot of faith that this will work. So we want to be in collaboration with you. And as I mentioned, the faith community, how do we actually inform our communities about the science, which is complex and evolving, and even our leadership federally don't agree upon what the science is, because we're still learning a lot about it. But we've learned enough now to develop a strengths-based approach so that we can heal people spiritually, socio-emotionally, while limiting the infection of COVID-19 to each other. So the next slide. So I just want to, I'm looking at the time now, so I'm going to rush through some of these slides, but I just want to say the June 3rd meeting with Dr. Morrow and the clergy was really just excellent. And I just want to say everything is still very relevant today, because we know the vaccine will come and immunize the San Mateo County community, hopefully within the first half of 2021. It's going to take a while for herd immunity to occur and for the second vaccine dose to come in. So we'll still have the virus circulating in the community. But as we have more and more protection, we still don't think that we still think it's much more safe to have a virtual service online than coming together in a large group, because we're not going to have herd immunity by that time. I appreciated the comments about some of our people are desperate to meet. And for those people who are in study groups reading the scripture and text, those are the small stable groups that we might have an opportunity to provide some direct services for in small stable groups. If they're in small, for example, Bible study groups that don't change over months of time, that's a good opportunity for us to provide some direct healing if it's needed for that community. For people who can have spiritual healing through virtual means, I think that would be best from a COVID-19 infection perspective. So I think I mentioned already the restrictions, how long they would be. I think at that time, I think Dr. Morrow was right at that time. It's 1 to 2 years how long these restrictions are going to be. 1 year from June 3rd will be June 3rd, 2021. At that time, maybe most of the people hopefully will have received a second dose of vaccine. It's not going to be 100% effective, and not everybody's going to have the vaccine, and some of the immunity is going to wane. So people who are in their 60s and 70s, and those with family members who are in 60s or 70s, are still going to be concerned about transmission of this virus. So that's why I think it's 1 to 2 years is really right on. So, I think there are some comments about, I can't imagine coming back until there is a vaccine. I agree that coming back with a large service in which people are shoulder to shoulder with each other might not occur for many years. So how do we meet virtually like this? And how do we actually meet in small, stable groups with the right amount of spacing, with the right amount of ventilation? So yeah, with next slide. And I'll just give reference to some of these slides. So this slide is to show that this recent surge is in all parts of the county. The next slide. Oops, one back. So the major issue is that even older adults above 60, there's this large surge of cases, which we're starting to already see the increase in hospitalizations. But the transmission is, again, drastically high in those young adults in the 20s and 30s and even up to 60. And again, if they're connected to family members who are with complex medical conditions who are older, that can quickly lead to hospitalization and deaths. So next slide. So I think I mentioned this already. These are really the three major points. Oops, my slide just, I'm trying to log back into my, oh, I logged back in, okay, my computer. So yeah, so transmission without symptoms, I would say over 50% of the cases. That's a major point to remember for you and your teams and your leadership. The small droplets that are airborne, which is what makes us different than influenza. Both of these top two things is so easily, basically the virus collects in the throat, in the mouth, and the nose, and in high numbers and high concentrations, many times before a lot of severe symptoms occur. So that's why when you're singing, you don't even know it. The virus is already lingering in there before it causes cell death in the epithelial cells. So that's the reason why it's so transmissible. People don't even know that they're transmitting when they're singing or pulling down their mask to talk to somebody. And you can see the mortality rates are still very high for those who are over 70. This is not the case fatality rate, which is even higher, but those who are infected and don't even know that they're infected. The best estimate from the CDC is that if you're over 70, the infection fatality rate is about 5%. And that's what we want to prevent. So next slide. So as I mentioned, this guidance is really quite strong. And next slide. It's on the CDC website. And they have specific limitations on indoor guidance, indoor attendance. I think that's a very blunt instrument to be utilizing. It's actually more how you can figure out all the details that they have in there using the principles we just described in the previous slide about transmission and how the virus gets transmitted. If you utilize those principles, you'll be able to adjust your services by talking to by like meeting like this in forums, comparing plans. And I think we'll be able to figure out, for a certain segment of your congregation who would like to meet in person, there might be an approach that things could be done relatively safely. So next slide. So, and these are all the sections, and with those major three principles, the major adjustments are within the physical distance guidelines and the considerations for places of worship. That's, I think, the major place to focus. So next slide. I think this emphasizes, again, what I would emphasize, alternative methods such as internet live events like this are helpful. But if you go on to the second or third page sections of physical distance guidelines, just remembering those transmission cues are things that this part should be really emphasized. I think some of the things that if you have to prioritize your resources and thinking efforts, some of the information about contacts, about doorknobs that might be contaminated and cleaning, those are important, But we're learning from this virus that it's not, it's the contact precautions are less important. They're important, but less important than the possibility of this being airborne with talking and singing. So if you had to focus on one thing, it's about really focusing on these physical distancing guidelines. Furthermore, about good ventilation. We're gonna, so look for that type of information, because that's the thing that public health authorities are probably going to be focusing on in the next few months. Next slide. So we hope that we'll be able to work together. I mean, I think San Mateo County, many of the residents, we build trust with each other. We're a relatively cohesive community. We as public health leaders believe with you all as faith leaders about the importance of mental health and toxic stress. So we want to balance the importance of spiritual healing with the infectious disease. And we think that many of our community, if we explained the reason for us adjusting services because of the virus and the characteristics of the virus, they're going to be able to follow instructions more so than if we're just telling people no or stop doing this. And we should give them suggestions of what we could do together. So next slide. I think this is my last slide. So these are the considerations. How do we provide our services in healing, in social support bubbles of, you know, a one family unit, maybe it's 2 family units, or at most 3 family units who might be in a faith group together already over months at time. I think, as I mentioned, you know, investing in online video conference meetings is probably going to be needed for years, probably, as well as outdoor services and good ventilation. I think I described face coverings already. One thing that's very risky is when you're coming back together in red, orange, and yellow, is that eating, because you're taking off your mask and you want to talk and socialize, is something that's going to cause infections. So those procedures to either not have any eating or to really be able to limit it to within the household is going to be crucially important at that time. It's not just having different forks or serving trays, which is important, but if people are just eating with each other and with their mask underneath their chin, that's when a lot of transmission is going to occur from super spreaders, who are sometimes the most super social of our groups. So we ask you to inform your congregation and be partners with us about isolation and quarantine. We at the Public Health Department are not going to report anybody to immigration, or our part of doing isolation and quarantine is just to make sure that this disease doesn't get transmitted throughout your congregation and throughout their communities and throughout to their extended families. And we want to provide the resources that they need to get them through isolation and the quarantine period. I think that's it. Now, next slide. I think that's it. Okay. Well, I thank you for your time. I really look forward to hearing the conversation for the rest of the hour, and thinking about best practices that we can learn from you all, so that our guidelines could be more precise in the future, and that we could do the guidelines with you in the upcoming months. So thank you so much for your time.
Hi, my name is Emma Gonzalez, and I'm with the Office of Community Affairs. And thank you all for allowing me to be here today to present on what we've been doing to really do our outreach and really grassroots, on the floor outreach and working with our community partners. Next slide, please. But before we start, we're going to I want to take a quick minute to take a poll. I think it's Tanya, if you don't mind. We have a quick poll. If you could take just a few minutes to do this. We have 3 questions. We'd love to just learn a little bit more about how the services are currently being provided. Have you done any of the following in relationship to COVID? Check any that apply. as well as does your faith community, how do you plan to attend some of these upcoming holiday um, celebrations? Observe. If you could just take a few minutes to complete that, that would be great. I'm going to allow 30 more seconds.
Emma, you can also continue if you want to let the poll run a little longer. We
Can
can
you
do that.
the next slide, please? And I think we can end with the poll and I'll get back to you on that one. Next slide, please. And if we can close out the poll. So I want to share a little bit about our collaborative structure that we have with San Mateo County. And as you could see, we have our San Mateo County Recovery Council that represents our community and executive leadership. But we also are well informed by our cross-sector leadership, our leadership that includes government, housing, library, education, PIOs. I mean, really a cross-sector of organizations and faith. And I think we also have, including faith-based leaders, that really ensure our equity access into making sure services are provided in an equitable way. We've broken it up to our region to make sure that our outreach efforts are really hitting the right places in the right time, in the right locations. We know that we could hit the mainstream, but we really need to get down to the grassroots, boots on the ground, I like to say. So we've broken up our region by 6 different locations, and we'll explain more. And really, I look at this as a funnel. So information is bilateral, by going across, but really at the end goal is to reach our community at large. Remember, 770,000 residents that we are trying to reach, and we need your help to do this. Next slide, please. We can't do this without community partners. And to date, we've been able to fund 34 organizations. As the county has response to COVID pandemic, it is essential that the county continue to work with our trusted messengers to ensure that the community receives culturally competent and timely information and how to remain safe and healthy. All funded partners are trusted within our community base, and they lead and they help us who are leading to serve communities disproportionality impacted by COVID. These awards went out to these organizations. And next slide, please. And we'll share with you kind of the blueprint of how they were went across the county. So as I mentioned, there are 6 regions within the San Mateo County. And you'll see that in the bottom quartile, which is a darker blue area, which is based on our Healthy Places Map Index. The coverage is where we want to go. And you'll see that we have some great coverage working with these community-based organizations. In the northern region, which is Daly City, San Bruno, South San Francisco, 13 organizations. Central San Mateo area, 16. Redwood City, North Fair Oak, 16. East Palo Alto, East Menlo Park, 17. Northern coastal area, 10 organizations, and down to the other coastal side, 9. We have great coverage, and so we're happy to report back that this includes, this ensures that we are, really trying to map and get to those areas that are most in need. And we work within our census tract area, and we're able to really get it down to those census tract areas. So our funded partners will be covering all those areas that are in need and are evenly distributed throughout the county. Next slide, please. Actually, our funded organizations have already kicked off and well under efforts. All funded partners have received outreach training and toolkits that included PPE for what we call our community action teams. They receive face masks, face shields, hand sanitizers. They received a toolkit that really provided them with all the essential information, which is an evergreen, how to access free and no cost testing in your neighborhood in multiple languages, as well as how to answer the call. Part of our outreach is also to educate about the contact tracers and how to limit social gathering and how to do it in a safe and safe way. Each of our partners also received what we call as the county resources that tells them that kind of the information, how they can also share and disseminate information to our community partners, as well as our immigrant resource guide. We have also, and you'll see here with the information, we already have an example of our coastside farmers market in the middle has already started to use the information that was provided in their toolkit and share it widespread. And they have a resource table and already sharing that information. The other thing is that it's important to know that OCA is providing additional funding to all our funded partners to conduct an additional boost for the holiday specific COVID outreach, including cultural specific observations for November till the New Year's. So we provided additional funding for our community-based organizations to do that same very thing. And so many of which are already maybe working with you. Next slide, please. One of the things that you might have already seen in your community is our Mask Up campaign. And our Mask Up campaign really is to educate our community members of the importance of wearing a mask. Here is our community cruise van. You might have seen that in your community where we go out on a daily basis, Monday through Thursday, and distribute masks to our community members most in need. When we pop up into these communities and we notify and we post it up and notify when, where, and what locations and what cities. We identify the locations based on health data and by census tract, and that's how we're identifying those locations. To date, over 14,000 masks have been distributed to our residents within San Mateo County. Next slide, please. And here's an example of our December calendar. So we'll identify the city in which they'll be, and then specific dates and times of where we'll be at each of those locations. Some of which we've partnered up with our food distribution sites in those areas as well. So we work in combination. Not only do we work at a food distribution center, but we also pop up in a community and say, we'll be in this particular area and walk around and have a conversation and do educational outreach. Again, back on boots on the ground. Next slide, please. Next slide, sorry. We're now going into some of the advertising that we've done to date. And again, we know that we have to do our advertising or our educational outreach using multiple languages. So here's an example of some of those that you may have seen. We use that through whether they're there through the La Opinión or through, really the hyper local ethnic media channels. And we get that information out into our community in language. Next slide, please. Additionally, we've created a holiday flyer, again, in multiple languages. It's created a two-sided flyer to offer guidance for celebrating the holiday safely, as well as recommendations for safer travel. This flyer will be posted and is posted on the county website, circulated on social media, and distributed among all community partners. If this is something of interest, we can certainly make this available to you. And so again, this is additional information that we've provided, and what you'll see is one clearly thing that you'll see is a negative test does not clear you from visiting relatives. It doesn't mean, so that's important, I think, back to what Dr. Chan has mentioned. Next slide, please. We also have our community resource e-newsletter, which I hope if you haven't currently receiving that, please sign up and access that, and you could get that distributed to you. And it's in both English and Spanish. That goes out on a monthly basis. And currently today, actually in this next month, we have a holiday edition going out to being mailed to 30,000 residents. And we base that on the most vulnerable communities in San Mateo County. So 30,000 residents will be receiving this. If this is something of interest, please sign up on our smcgov.org, and we'll put that in the chat box as well. Next slide, please. On a weekly basis, we've developed a communications calendar, and I think this might be of interest to you. I know each of you might already have your, we want to leverage your communication, how you already are currently working. We really have a communications calendar that goes out every Monday, and it really is a turn the key, plug and play model where we already provide community-based organizations, partners with the text as well as graphic and what to say on Monday, Tuesday, Wednesday, Thursday, Friday. And it's information ready to go, cut and paste, and in language, English, Spanish, and Chinese. So please, we hope that you would like to, if you're currently not on our distribution list, we'd love to have you participate and get on this distribution list. And you too can get this and share this with your fellowships. And this is a way to follow us on SMC_comm affairs. But this is currently going out to now over 350 community-based organizations. So we want to make sure that this is also something that's being leveraged by our faith-based organization. Next slide, please. And then I think we'd like to follow up with, here is our outreach toolkit. Should you be interested in receiving any and you accessing any of our resources, flyers, collateral, you too can find that through our through this website here, and you can download any of that information in language. Right now we have over 100 different things, social media even ads that we put up there. So you're more than happy to use any one of those things as well. And we open to receiving any feedback. We do hold regional calls. As we said, we broke it up into 6 regions. We hold regional meetings with our community-based organizations once a month. So you're more than happy to also attend one of those if you want to learn what's happening within your region. Please just shoot us an email. Next slide. And thank you very much. I know I went through that pretty quickly, but I wanted to make sure, one, you were aware of what the county is doing, but in collaboration with our community-based organizations. Again, we cannot do this alone. We need your help. And we'd like to see and how we can partner and leverage your communication. And if you're not currently receiving if you're interested in being on our weekly communications calendar, we can definitely get you on that, as well as if you're interested in receiving our resource newsletter, e-newsletter, that too is available both in English and Spanish. Thanks again, and thank you for allowing me to share today.
All right. Hello, everybody. My name is Isaac Frederick. I am the co-chair for the Spirituality Initiative. I'm also a mental health counselor for behavioral health and recovery services for the county. And like many of you, I'm a member of the Clergy. My church is Genesis Worship Center, Church of God in Christ, which is located in Oakland, California. So we had a point to where we wanted to be able to go into talking about some of the successes and the challenges, but from looking at some of the responses and knowing that where we're at right now, and also given time, we want to be able to get to some of you guys' questions. Most of these questions have been around about gathering in person, kind of what to do. And so we want to kind of just open it up to that. It would be great to kind of, hear some of the successes, but what it literally looks like is that you guys everybody on here is really wanted to know kind of real-time answers right now in terms of what's going on, what can you guys do as a community of faith leaders and stuff. So I want to so in doing that, I think we can just open it up for the questions that you guys have. Maria, do you want me to just go ahead and just read some of these questions, or should we just leave it as an open forum?
Isaac, this is Francis.
Yes.
Hi, would it be helpful if I read some of the questions from the Q&A and then
that would be great
for the panelists to chime in?
Yes, please. Thank you.
Wonderful. So I know some of them have been answered. Thank you so much, everyone, for being patient. And we're adding questions on chat and we're also capturing those. Let me go ahead and start with a question from Jerry. Oh, no, sorry. Yes, Jerry. Jerry wrote a little bit earlier today, is it better to just completely suspend in-person activities until, say, next summer? If so, tell us so. Please use your authority and your medical expertise, we need you to tell us the truth and to say in so plain language, we need health and not politics here, excuse me. Please don't equivocate or pedal. Thank you, Jim, for the question. So I will open it to our panelists for a response about in-person activities.
So I assume I should take a first approach of this. So, you know, from my perspective, it's not I mean, I'm not talking about politics, and it's about balancing what you know of your community and their spiritual needs and mental health needs with what you're reading about the virus in what I've explained earlier and what I can explain in the future to you. It's that balance. From a disease prevention perspective, it would be great to not have any in-person services until everybody gets the vaccine. But like I mentioned, not everybody's going to get the vaccine, and it's not going to be effective for everybody, and immunity will wane. So it's, as Dr. Morrow mentioned, it might be 2 years before we get back to any semblance of normal. And most people, including Dr. Fauci, says we're never going to be back to normal again. So, and I don't want to be saying to you all that you're never going to be, to close forever. I think we're going to need to transition to a different model of service, just like we've done for public health and medicine. And I'm happy to try to make the concepts clearer. And sometimes it takes a while and a lot of conversation back and forth to translate this into to specific activities.
Thank you, Dr. Chan. We have another question that you may be able to answer. This is around local churches and as testing sites. So Mo writes, will the county consider utilizing local churches as testing sites? And most importantly, vaccine distribution / taking the vaccine?
I don't know the specific answer to that. So we can get back to you. I think it's a good question in terms of using religious spaces.
I can help you out on that one, Curtis.
Great.
Good morning, everyone. I'm Srija Srinivasan from the county health team, and we have engaged with faith leaders to explore whether a church parking lot may be a good option in certain instances. It ends up really being about the logistics and the flow of your physical plant, and that will be the same type of considerations for vaccine distribution as we get later on in the distribution when we know of the timelines for it to be available to the general public. So if any of you would like to volunteer your physical plant, we can include the contact information for our Department Operations Center liaison, and happy to talk with you individually.
Thank you, Srija, for stepping in and providing that answer. And I do see one hand raised right now. I see Mo, you have your hand raised. I'm going to go ahead and allow you to unmute yourself so that you can provide comment. Give me just 1 second. You can go ahead and unmute.
Hello, thank you. Good morning, everybody. Good morning, Chief Srija. Thank you for answering that question. That was the main questions. I'm sure I've talked to our ministers in the church. They'll be willing to open up we have a big parking lot, big hall for testing, and most importantly, as Chief Srija informed us in our last task force meeting for Pacific Islanders, that we are one of the most vulnerable communities and would like to also be considered that in the distribution of vaccines, that based on that, the most vulnerable community, Pacific Islanders and indigenous people. So we'll be willing to use our church facility for not only testing, but most importantly, vaccines. I've heard the idea of the fear of people not taking vaccines. I know for our community, we can use our church resources and our pulpit to ask our people to come in together to take the vaccine.
Thank you, Mo. Thank you so much.
Another comment is I like all these informations that Emma Gonzalez has informed us today of all the services provided by the county. Unfortunately, I had bad experience trying to help our church members who have been affected with the virus. When I went to the county health website and was referred to the 211 services. When I asked for help, for example, I was told to have the affected person sleep in a car because the county doesn't have any resources to help. So it's good that all these services are available. Unfortunately, we're not getting the word out to the people how they get these services. In other words, it has to be a better connections and communication through the 211 services. Thank you.
We appreciate the feedback, and we learn from the examples in which we don't do as well as we should have. And, we need to keep getting better so that the trust can continue to increase, and appreciate learning when we're not meeting that need.
Thank you, Chief.
Dr. Chan, by the way, I'm William Cruzy. I'm one of the co-chairs of the spirituality. Dr. Chan, several questions have come up about singing, because this is the time of the year people sing Christmas carols and that kind of thing. Can that be done safely outdoors? Can it be done safely indoors?
Singing is probably the #1 most transmissible thing that can be done. So particularly in this holiday season, when people are singing together in groups, even if it's 6 feet and 10 feet away, it's very difficult to do. And can cause a major super spreader event. Some of our most famous cases of super spreader events are from singing. So I would definitely recommend not doing that. Singing virtually, where you could actually see people's mouths move, not be masked, to me would be a much better approach. And I think if you're going to be encouraging singing, there's going to be a lot of complaints in your community about the fact that you're singing as well. I think beyond, I saw previously from the FAQ from 5 months ago, the prospect of, for example, singing, I think maybe Dr. Morrow said 100 feet away, but I think singing 30 feet away, one person with a microphone, with a plexiglass. I think those are the things that we would like to talk to you about, that there might be some ways in which we could have a harm reduction approach that I think if it's done outdoors, I think if there's enough healing from that singing, my personal opinion is that it could be done safely, but with, like I said, 30 feet away, a microphone. So, but I think for the holidays, Bill, singing, and I saw some questions about caroling. That's just really could be a disaster, because 12 people transmitted to each other, they bring it back to their families when they gather for the New Year's or for Christmas, and that could be an outbreak of 40 people. So that's the reason. So thank you for that question.
Thank you, Dr. Chen. One of the questions that we had, you probably is maybe if the church, I was assuming Siraji probably can answer, is if churches or faith organizations wanted to have their site as a place to collect masks for communities and whatnot, and if they got those masks, where would they be able to drop those masks off to be distributed to the community in San Mateo County?
I think maybe Emma might want to take that one. The county has secured masks to distribute in our least resource communities and partnering with many entities, as Emma described. I don't know if we're accepting donations of masks.
Yes. Hi, this is Emma. Thanks again. Yeah, we are accepting mask donations. You're definitely able to reach out to us you could either call us at 363-1800, 650, or shoot us an email, and we'll put that contact information. And we're located here in Redwood City at the county center.
Thank you, Emma. One of the other things is that, Dr. Chen, one of the questions that somebody had here is face shields as effective as masks, or do you need to always wear masks? And that was the other question that's kind of pertaining to a person if they're in a room at maybe say their place of worship by themselves or in a collaborative with their direct members of household, would they all need to have on mask still? So it's pretty much just about what is the most effective way in terms of preventive measures.
Yeah, facial coverings, cloth facial coverings are more effective for yourself and also for others than face masks are generally. I mean, those face shields, those plastic ones that don't tightly cover the mouth, I assume that's what we're talking about, because the face coverings has more source control, and that's the biggest thing it does, is provide source control. And so that's definitely cloth face coverings are definitely more effective to prevent infections to others. And in terms of preventing infection from yourself, I've seen these face shields that's being worn. I saw by NFL coaches that almost has very little protection from breathing in. I mean, for yourself, from breathing in the virus that's in the air from somebody else. So if you want to do both, obviously that's not what you asked me, having a cloth face covering and a plastic shield, that prevents a small likelihood of the transmission going through the eyes. But to answer your question, cloth face coverings is the best way for source control.
All right. Thank you, Dr. Chen. So we know also, I think I said it earlier, we know we were not going to be able to answer all the questions, even get feedback as far as what has been working. Francis, there was somebody that had a question or had their hand raised. And we're also mindful of time. We're about 4 minutes.
Thank you, Isaac. Lisa, I see your hand up. I'm going to go ahead and unmute you. And yeah, we have just 1 minute. So you can go ahead and unmute.
Hello, thank you. Can you hear me?
Yes.
Okay, I'm from the Methodist Church in Half Moon Bay. I just wanted to put out an idea. This is pretty much just with the Christian community about Christmas Eve worship, and an idea for making singing a little more safe. What we're going to try to do in Half Moon Bay among all the clergy on the coast side is at 10 p.m. on Christmas Eve, we're going to ask our local radio station to play Silent Night. And we're going to ask everyone, if they want to go out on their own driveway, hold a candle and sing Silent Night, which in the Christian community, Silent Night is a big deal for Christmas Eve worship. And this is a way that people can still sing, still have a sense of community, but be safe. So I just put it out there as an idea if anybody else wanted to try that in the county.
That's an excellent idea.
Just want to add that implementing an idea like that actually saves lives. So thank you. If we could do that together as a whole county and collaborate with other community organizations and government, that something like that, this actually does save lives. So thank you so much.
If any faith leaders wanted to coordinate with me on that, I'm happy to make that a wider thing in the county.
Yeah, Lisa, could you put, this is
Go ahead, Reverend Nixon.
Thank you. Lisa, could you put your email in the chat so that we can easily contact you? Because that's just a wonderful idea.
I will do that.
Great. And I think for us faith leaders that, you know, the message that Dr. Chan just said out loud is the message that we really need to get out. Like what you just said, Dr. Chan, just, you know, that could save lives. I think that's the kind of message that as faith leaders, we really need to broadcast. And I know we're out of time, but I did want to say that if you as faith leaders, we as faith leaders want to have a follow-up discussion and share more ideas, or get one or two of the county people back on to dive deeper, because this is huge. I mean, I think we've heard some really sobering things today. Not that we didn't know these things, but to hear them from our own local experts, and to, you know, think about, wow, like, you know, what Dr. Fauci said, we may never go back to normal. And what does that look like for us as faith leaders? And so I think we're happy to do that. If there's interest in that, please let us know. And the Peninsula Solidarity Cohort can easily set that up.
Thank you, Reverend Penny, for saying all of that. We hope that the role of the Spirituality Initiative, we're going to tell you more about it, but we don't have time. We do have a website that you can go to. So if you are interested in following up, please indicate so to us, from what Reverend Penny said. We really, have appreciated your participation, your time. We know this is an incredibly busy time for all, particularly those who are Christians. So we thank you for taking the time, for raising your questions. We're sorry we didn't get a chance to answer everything, but it's a beginning. We will be sending the slides out, and I think some of them will help. If you are interested, the last slide, if somebody could put the last slide up, there is an email to one of our co-chairs that you can send your information to, and we will be glad to follow up and get back to you, particularly regarding what Reverend Penny said. So thank you all, because we know that you're a very important part of the community. And that is what you do. The spirituality, religious understandings that you bring into the community are so vital right now with all that is happening, not only with COVID, but what's been going on in our communities around many different issues. So thank you for being a part of this, and thank you for being here today.
Yeah, thank you so much, Penny. Thank you, Bill, for your leadership.
So I think that concludes our.
It does conclude our. Yeah.
Thank you to the county for this incredible time.
And thank you to all who are here. We will definitely be following up with resources, with the slides, and are available for any additional questions or supports that you all may need. And we really do look forward to continuing this relationship and the mutual support of one another. So have a wonderful day, and thank you all for joining us.
Thank you, everybody. Good one.